Good morning. I'll go ahead and call the meeting of our Health Subcommittee of Appropriations to order, and we'll be considering the FY20 budget. So the members, you all have your tracking sheets and information that we've been working on for several days here. So I'm going to run through here, and I'll just highlight the changes as we move along. Okay. 17.1.11 is just a reduction of funds, one-time funds for that was a delivery system analysis that was done, no longer needed. 17.1.12 is just a language. 17.1.13 is language also. 17.4.4, this eliminates the one-time startup funds that was in the budget from last year. 17.4.5, this is for the Champions of Children that we've all heard about. This would be a $256,000 add to that. 17.4.6, this provides funds for 2 primary care center startups in Scriven for primary health and in Chatham County for behavioral health services. 17.4.7, this is using existing funds, no new money there on that, just the language, using existing funds. 17.7.1, this is just a updated reflection of the projection there, slight change in the number. 17.7.7, this is an increase in the installment of a 2-year plan to increase the personal need allowances for nursing home residents to meet the $20 per month goal that we had set. This is $2.50 increase, which is half, and that leaves $2.50 in that for the personal care. 17.7.7, this provides funds for nursing homes to help with the enhanced background check expenses, $330,000. 17.7.9, this is to provide funds for supplemental payments to general acute care hospitals with inpatient child and adolescent behavioral health centers so that they're paid the same rates by Medicaid that they're paid by the CMOs. 17.7.10, provide funds for nursing homes for a direct care rate increase. This is to increase the pay rate by $1 for RNs, LPNs, and CNAs and nursing home staff to help to attain and retain and attract direct care staff. 17.7.11, this provides for a 3% increase in the nursing home ventilator reimbursement rate. 17.8.1, there again, this is just an update of the to reflect the projections for the program. Under physicians workforce, 17.12.1, this will increase the funds there for the 139 new residency slots. These that are actual slots that are ready. 17.12.3, this provides funds for the second year of the Gynecological Oncology Fellowship at Augusta. This is the second and final year of the funding for this fellowship that we added in the FY19 budget. 17.12.4, this provides funds for 54 slots for OBGYN residency programs at Emory, MCG, Memorial, Morehouse, and Navicent at a capitation rate of $15,333 each. 17.12.5, this provides funds for Augusta University for their rural surgery initiative. 17.12.6, funds for Augusta University for the child and adolescent psychiatric slots. These are accredited slots that they have, but they have been unable to fill due to the funding. 17.12.7, this provides funds for the AHAC network to expand their statewide certification training for health professional students to as mental health first aid trainees. This will pay for 15 instructors who will be able to train 675 students. 1712.8, this provides funds for a startup grant for the South Georgia Medical Center Residency Program. This is half of the request that they had needed to get that started, and then hope to be funded through the GRAPE program by the Regents. 17.14.1, this we've all heard a lot about this maternal mortality. Georgia's ranking is very near the bottom, and there's a lot of interest from a lot of people trying to work to improve that, and this is one of the pieces of that puzzle. Provide funds for a Center of Excellence on Maternal Mortality at Morehouse School of Medicine in order to advance the maternal health in Georgia. 1714.2, provide state funds to offset a reduction in federal matching funds for graduate medical education program there at Morehouse. 1715.2, this would utilize existing funds for the malpractice insurance for physicians and dentists who practice in an underserved area. They'll take care of both the dentists and the physicians. 1716.1, provide funds for a medical student capitation rate of $6,363 for 100 students at Philadelphia Osteopathic Medical School, Georgia, and then 40 students at PCOM, South Georgia. We have 287 Georgia residents in training at those schools. 17.17.3, provide funds for a medical director to improve the complaint process. This is the composite medical board. They say that they're having the complaints and it's taken them a while to get to us. This should speed that up by some 90 days to handle those complaints in a more timely fashion. 1718.3, this provides fund for a data management system to track and manage investigations for the Drugs and Narcotics Agency. They have over 49,000 registrants they have to keep track of. They do over 2,000 inspections and over 400 investigations out in the field. Moving over to the Public Health Department, 38.1.4, provide funds for maternal mental health to screen, refer, and treat maternal depression and related behavioral disorders in rural and underserved areas. This is part of that program I mentioned to you earlier, that there are several areas that we were going to be looking at to try to get better results in those areas there. 38.1.5 to provide funds for the Maternal Mortality Review Committee. This will help them take this backlog of cases they've got so they can look through them in a more timely fashion to try to determine what the problems are and how best to treat those problems to move this program forward. 38.1.6, this provides funds for a nurse peer assistance program to support nurses recovering from substance abuse. 38.1.7, provide funds for Regional Cancer Coalition to enhance screening, awareness, prevention, education, and care coordination and navigation. This is part of the request that was requested from CORE. The 38.1.8 had quite a few members that were interested in this funds for the Sickle Cell Foundation of Georgia. This will fund sites in the Columbus, Valdosta, and Albany area. And 38.1.9, provide funds for feminine hygiene products to be provided to low-income female patients at county health departments. 38.7.6, this provides funds for 2 satellite perinatal support sites in Jenkins and Wilcox counties where they have no services whatsoever and have one of the highest maternal mortality rates in the state. 38.8.4, this provides funds for newborn screening to include 4 additional disorders that have been approved by the Georgia Newborn Screening Advisory Committee. This will add 4 to that, and this is seed money. The the fees that will be collected from this will go into the general treasury and will pay for this, but this will be money to get that started. And that completes the changes that we had on our part of the budget. Are there any questions or comments from members of the committee? Hearing none, I'll entertain a motion. Have a motion and a second to do pass. Any other discussion? Not all those in favor, please say aye. Any opposed, say no. Motion passes. Thank you very much. We're adjourned.